Today's topic is vitamins. Vitamins are organic compounds produced by bacteria, plants, and animals which are essential to human health. The name itself comes from the Latin word vita, which means life. Vitamins are nutritional essential molecules because most of them are not made in our body or only in insufficient amounts. We therefore have to obtain them through our food. As a consequence, an insufficient intake of a vitamin may lead to a specific deficiency syndrome depending on the severity of the deficiency. Vitamins can be classified as water or fat-soluble, depending on their ability to dissolve in water or fat. This in turn affects the way they are absorbed, transported, and stored in the body. So, properties of fat-soluble vitamins and water-soluble vitamins and the difference between them. The fat-soluble vitamins are more stable to heat than the B vitamins, and they are less likely to be lost during processing and cooking of foods. The fat-soluble vitamins are absorbed from the intestine along with fats in foods, so anything that interferes with fat absorption results in lower absorption of these class of vitamins. The fat-soluble vitamins are first absorbed into the lymph system and then into the blood, whereas most of the water-soluble vitamins move directly into the blood after absorption. Because the fat-soluble vitamins are not soluble in water, they are also not soluble in blood. As a result, the fat-soluble vitamins require specific carrier proteins to transport them through the body. Water-soluble vitamins do not need carrier proteins and travel freely. Water-soluble vitamins are poorly retained by the body, and any excess is mostly excreted via the urine. The fat-soluble vitamins, because they are not soluble in water, they are also not excreted in the urine. Instead, they are stored to a considerable extent in the body, mainly in the liver and fatty tissues, until they are needed. Because of that, deficiency symptoms develop relatively slowly. Moreover, because they are stored, the fat-soluble vitamins can be eaten in large amounts once in a while, whereas the water-soluble vitamins need to be eaten more regularly. The storage of fat-soluble vitamins is not all good because it may also lead to toxicity. For example, when using supplements. This is especially an issue for vitamin A and to a lesser extent for vitamin D, but is much less of an issue for the water-soluble vitamins because an overdose simply leaves the body through the urine. As an exception to this rule, vitamin B12 is a water-soluble vitamin, but it is retained in the body quite well. So, if we briefly summarize, we have fat-soluble vitamins and water-soluble vitamins. Whether a vitamin is fat-soluble or water-soluble has a mirror influence on how the vitamin is processed in the body, whether it can be stored, and when you ingest a lot of it, whether it may cause toxicity. Some functions. Although water-soluble vitamins have many tasks in the body, one of the most important in helping to free the energy found in the food you eat. Others help keep tissues healthy. Here are some examples of how different vitamins help you maintain health. Release energy. Several B vitamins are key components of certain coenzymes, molecules that aid enzymes that help release energy from food. Produce energy. Thiamine, niacin, pantothenic acid, biotin engage in every production. Build proteins and cells. Vitamins B6, B12 and folic acid metabolize amino acids, the building blocks of proteins, and help cells multiply. Make collagen. One of many roles played by vitamin C is to help make collagen, which knits together wounds, supports blood vessel walls, and forms a base for teeth and bones. If we discuss fat-soluble vitamins, together this vitamin quartet helps keep your eyes, skin, lungs, gastrointestinal tract, and nervous system in good repair. Here are some of the other essential roles these vitamins play. Build bones. Bone formation would be impossible without vitamins A, D, and K. Protect vision. Vitamin A also helps keep cells healthy and protects your vision. Interact favorably. Without vitamin E, your body would have difficulty absorbing and storing vitamin A. Protect the body. Vitamin E also acts as an antioxidant, a compound that helps protect the body against damage from unstable molecules. So as we told, vitamins are divided into two groups, fat-soluble and water-soluble. Fat-soluble vitamins A, D, E, K, and water-soluble vitamin C and vitamins group B. Vitamin A. Vitamin A was given the first letter of the alphabet because it was the first to be discovered. Vitamin A is a group of interrelated substances. retinol, and retinoic acid. Vitamin A is a substance that is beneficial in small doses and toxic in high doses. It plays an important role in vision, bone growth, reproduction, immune activity, cell division, and cell differentiation. 90% of vitamin A is stored in liver. So, the first function, role in vision. Vitamin A has been shown to be useful in helping with nighttime vision. Our ability to see is dependent on two main photoreceptors that sit in the posterior aspect of the eye, the rods and cones. The rods are useful for night vision, and the cones are useful for day vision. Vitamin A is one of the required precursors for the formation of rhodopsin, the photopigment found in rods. Rhodopsin helps us to see at night, and without vitamin A, rhodopsin cannot form and night blindness occurs. Rods are responsible for black and white vision. The eye rhodopsin is found in the rods that are located in the retina. Rods are composed of stacked discs. Rhodopsin is densely packed into each disc. Rhodopsin is responsible for night vision. The speed at which the human eye adapts to seeing in the dark depends on the amount of vitamin A available in the body, known as the vitamin A status. A dark adaptation test can be used as a measure of vitamin A status. Vitamin A deficiency is a major public health problem in the developing world, causing blindness in 250,000 people each year. Vitamin A supplements are successful in preventing blindness from this case. Vitamin A deficiency usually results from dietary deficiency, as occurs in areas where rice, devoid of beta-carotene, is the staple food. But it may result from disorders that interfere with the absorption, storage, or transport of vitamin A. A deficiency can lead to blindness, skin disease, and growth retardation in children. Impaired dark adaptation of the eyes, which can lead to night blindness, is an early symptom of vitamin A deficiency. Xerophthalmia, which is nearly pathognomic, results from keratinization of the eyes. It involves drying, xerosis, and thickening of the conjunctiva and corneas. superficial foamy patches composed of epithelial debris and secretions on the exposed pulbar conjunctiva bited spots develop. In advanced deficiency, the cornea becomes hazy and can develop erosions, which can lead to its destruction. Keratomalacia. On this slide, you can see Xerophthalmia. This photo shows chronic dryness of the conjunctival membrane with keratinized patches known as bited spots. In children with severe deficiency, growth is slowed and risk of infection is increased. Diagnosed based on ocular findings and serum retinal levels. Vitamin A deficiency can also be recognized by its keratinizing effect on the skin and mucous membranes. Dry, scaly, thickened skin with prominent follicular scale. Dry lips and thickened tongue. Keratinization of the urinary, gastrointestinal, and respiratory tracts. So, how is vitamin A deficiency diagnosed? Diagnosis of vitamin A deficiency is usually clinical. Measurement of serum vitamin A retinol is useful if levels are under 28 micrograms still, but the result may be normal if deficiency is mild. Low retinol levels are indicative of advanced disease, since the circulating levels of vitamin A do not drop until hepatic vitamin A supplies are depleted. Diagnosis is confirmed by therapeutic response to vitamin A supplementation. Vitamin A deficiency can be prevented through a diet which includes kale, broccoli, leafy green vegetables, beta-carotene-rich fruits such as apricot or peaches, and highly colored vegetables such as carrots, squash, sweet potato. Milk or cereals that have been fortified with vitamin A, liver, egg yolks, fish liver oils. Vitamin A is available in animal foods as well as in the form of artificial supplements. A particular rich animal source of vitamin A is liver, and consuming liver more than once a week may even cause vitamin A levels to rise too high. High levels of vitamin A intake can be toxic and lead to a condition called hypervitaminosis A. This is a condition seen in some Eskimos due to consumption of very high amounts of vitamin A from polar bare liver. Other examples of animal foods that are rich in vitamin A include eggs, cheese, yogurt, spreads that have been fortified with vitamin A. Plants. Plants have no vitamin A. They do contain compounds called carotenoids that the body can convert to vitamin A. Beta-carotene, found in the likes of carrots, spinach, papaya, mango, oatmeal, is a common precursor for vitamin A. The human body converts beta-carotene into vitamin A. And you don't have to worry about overdosing on vitamin A by eating too many carrots. When enough vitamin A has been stored in our liver, our bodies stop converting beta-carotene to retinol. The worst that can happen with a carrot overdose is that the skin can turn a yellow-orange color. Fortunately, it's reversible. Vitamin D. Vitamin D is both a nutrient we eat and a hormone our bodies make. It is a fat-soluble vitamin that has long been known to help the body absorb and retain calcium and phosphorus. Both are critical for building bone. Also, laboratory studies show that vitamin D can reduce cancer cell growth, help control infections, and reduce inflammation. Studies report that it triggers the body's immune cells to produce antibodies. Therefore, vitamin D promotes an overall increase in the strength of the immune system. Many of the body's organs and tissues have receptors for vitamin D, which suggest important roles beyond bone health, and scientists are actively investigating other possible functions. Few foods are naturally rich in vitamin D3. The best sources are the flesh of fatty fish and fish liver oils. Smaller amounts are found in egg yolks, cheese, and beef liver. Certain mushrooms contain some vitamin D2. Vitamin D3 can be formed when a chemical reaction occurs in human skin. When a steroid called 7-dehydrocholesterol is broken down by the sun's ultraviolet light, or so-called tanning rays. The amount of the vitamin absorbed can vary widely. You can get vitamin D from about half an hour of direct sunlight. Note that because ultraviolet rays can cause skin cancer, it is important to avoid excessive sun exposure, and in general, tanning beds should not be used. The recommended dietary allowance for adults is 600 international units daily for men and women. Vitamin D deficiency may occur from a lack in the diet, poor absorption, or having a metabolic need for higher amounts. People who cannot tolerate or do not eat milk, eggs, and fish, such as those with a lactose intolerance or who follow a vegan diet, are at higher risk for a deficiency. Other people at high risk of vitamin D deficiency include people with inflammatory bowel disease or other conditions that disrupt the normal digestion of fat. Vitamin D is a fat-soluble vitamin that depends on the gut's ability to absorb dietary fat. People who are obese tend to have lower blood vitamin D levels. Vitamin D accumulates in excess fat tissues but is not easily available for use by the body when needed. High doses of vitamin D supplementation may be needed to achieve a desirable blood level. Conversely, blood levels of vitamin D rise